And it's the time of year when a number of really important surveys come out. And the two that have recently come out is the inpatient survey, which takes place nationally, and also the cancer patient experience survey, which again takes place nationally. In terms of the inpatient survey, there are 65 different questions which our patients are asked to complete their views on. And out of those, we've come out as average on the majority. Well, average to some extent is good, but what of course we would like to do is be better than average, which means there's still some ground for improvement. I'm pleased to say that two of the areas that previously have shown to be a concern, we've done much better at. The first of those is supporting people to eat in hospital. Of course, some of our patients have difficulty eating because of their medical condition, or because they always have difficulty eating and need some kind of support. So we've improved on that. The other area that we've been found wanting previously was not explaining fully the medications that people get, mainly on discharge. And again, there's been big improvements in those areas. The one where we continue to have difficulty and have been found to be below average is around having appropriate environment for having private, dignified conversations, and that's in the accident and emergency department. Now that's quite difficult with the layout of the department, which for those of you who have perhaps used it will know the majority of the areas are in cubicles that are just separated by curtains. So we need to find different ways of having those conversations with some really poorly people in accident and emergency to improve on the situation going forward. And in terms of the cancer survey, there were 59 questions, so slightly less than the inpatient survey. And again, we were found to be at average or above average in the vast majority of those areas. Unfortunately, we were below average in 4 areas. The first of those is that we haven't made it clear to people that they can bring a family member or friend to the consultation where they may first be told that they've got cancer, which is clearly a really upsetting time. And so that's something we definitely need to get better at. The next two is about information. And the first one is we're not giving enough information about finance and the financial benefits that can be gained by people who are suffering with cancer. And the other one is around cancer research, where we've not been given information to people to allow them to be part of a research trial. Again, that's something that we do a lot of research and clinical trials, and we need to get better at. And the fourth area is similar to the main inpatient survey, where we're not giving enough privacy, again because of accommodation issues, when we're having those sensitive, difficult conversations with our patients. So we will put in action plans for both of those to ensure that we do whatever possible to improve on the situation for our patients going forward.